Good morning, folks. John Adamson with Seeking Light. Happen to be off today, so that's a good thing. Celebrating some Christmas with the in laws. It's still a good thing. Anyway, thought I would cover today briefly and not conclusively some of the dangers of not good documentation. And I want to approach it from the standpoint of a brief discussion on ethics and also dangers to the patient and dangers to you. So, with that said, I am in the process of developing several ethics courses, and the correlation of ethics with proper documentation is pretty clear to me. And it is something that I address in my documentation course briefly. But when we talk about ethics, we generally talk about ethical principles that guide healthcare. So, for instance, you've heard of beneficence and non maleficence. In other words, seeking to do good for patients and not seeking to harm patients. Also, justice, that we're giving fair and equitable health care to all people. Respect for persons and autonomy, which are heavily related to one another. So, a patient has a right to be respected according to their cultural preferences, which has to do a lot with informed consent and evidence based practice, and also autonomy, which again has to do with informed consent. So, is it clear in your documentation that you are showing things like beneficence versus non maleficence, that you're respecting persons, that you're not violating their autonomy? These things are very important. And we do know that from a legal standpoint, that the violation of ethical principles has been codified as law in most states. And so if you fail to adhere to ethical standards, oftentimes that correlates with some kind of disciplinary action against you and your licensure. So, one of the things that we do want to keep in mind are the ethical standards. These are very well outlined in the APTA, AOTA, and ASHA ethical standards. They'll generally tell you what ethical principle is being discussed in each of their standards. And so, understanding what those ethical principles are called, what they mean. So, for instance, beneficence is equivalent to compassion in the APTA ethical standards guidelines. So, understanding how you demonstrate that in your documentation is really important. And it boils down to protection for the patient and protection for you. Little story. Back when I was doing traveling therapy in 2007, I we were checking out South Dakota. I was thinking about moving to South Dakota, and we there was a company that I worked for quite a number of years afterwards as a full-time employee, but I was a traveler at the time, and they had a number of buildings in Rapid City, South Dakota. And so I took a travel assignment with them, and partway through my travel, I was changed from one building, which set me up from day one for success. I was taking over for a therapist that was on an extended maternity leave. I was given really good notes. The director of rehab was very thorough and organized in having everything ready for me, so that, as you know, travelers get like minimal to no orientation. From point one, walking in that building, to within half a day, I had what I needed to be successful and treat patients safely and effectively. I transitioned to another building about a month later. At that building, I was covering for a therapist that was going on an extended vacation. He had left me no notes of any sort and nothing verbally communicated really to his fellow staff members, so that I walked in day one being in an ethical situation where, in order to safely and effectively treat the patients, I would need to reevaluate them. And that was scary. I actually ended up calling him as he was getting ready to board a plane, heading to some vacation destination, just so I can get a rundown of his patients to safely and effectively treat him. So, good documentation does correlate with proper treatment of patients. You've probably heard the adage, and I think I've probably used it in the past, but it's not entirely accurate. It is this: some good therapists document poorly. In other words, we've all known therapists we would say are excellent therapists, but their documentation is atrocious. And I would say ultimately that may be the case in certain instances where you have therapists who have excellent memory of all the things going on with their patients. They're heavily invested in their patients. They're keeping track in their mind of what's working, what's not, and they're truly doing evidence-based practice. The problem is that that treatment becomes fully dependent on the therapist being there, being present.
Okay, that was weird. Let's see if it's picking up. There we go. Sorry, guys, it briefly cut out. So anyway, going back to the therapist who, is a good clinician, photographic memory of what's going on with their patient, keeps that in mind as they develop safe and effective treatment plans. And as long as they're following the patient, they're doing quite well with the patient and the patient's getting good care. The problem is if that therapist is off for a day, has terrible documentation, and has not communicated well with their staff members, you can't really say they've got evidence-based standards of practice going on because they've not safely and effectively communicated with their fellow staff who's taking over that case for the day, week, whatever it might be. And so there really is no sense in which the statement is true that some therapists are poor documenters but excellent clinicians, because an excellent clinician is also going to set up the patient very well for being transferred to another clinician, because who knows what can happen tomorrow. A therapist might have had an accident, be unable to treat patients, had a death in the family, need to be off emergently, whatever it might be. And so good documentation provides a protection for the patient. Now, what about for the therapist? I haven't seen a lot of lawsuits, but I have seen situations blow up, even for good therapists, between patients and loved ones who attack the therapist relentlessly, sometimes through no fault of the therapist. I've been involved in investigations of patient complaints. And one thing that can be lacking is good documentation that demonstrates that standards of care, lack of violation of legal principles such as informed consent, are present. And this sets the therapist up for a lack of protection. So what have we seen so far in this brief discussion? Proper documentation does provide the basis for better care that's safe and effective for the patient. Proper documentation does provide better evidence or better care for transitions between therapists. And better documentation will protect the therapist from litigation against them, which could lead to disciplinary action, including and not limited to loss of license and potentially even jail time in some states. So anyway, I hope this convinces you to do good documentation for those three things. Anyway, hope you're doing well. Take care and God bless.